All right. Okay, everybody. Opening the Committee on Health, Human Services, and Homeless for the purpose of hearing agenda for Tuesday, March 16th, 2021, the 9:30 a.m. agenda. The chair would like to remind the testifiers that we do have a 2-minute testifying. And all your testimony is recorded. And if you submitted it online, it'll be put into the record. So we have a lot of bills today due to the deadlines. Okay, so first bill, HB 506 HD2, relating to the issuance of special purpose revenue bonds to assist Wahiawa General Hospital. I have Wahiawa General Hospital.
Yes, thank you. Good morning. This is Brian Cunningham. I serve as the CEO for Wahiawa General Hospital. Good morning to the chair, vice chair, and the committee. I stand in strong support of SB 506, and I'll be here for any questions you may have. Thank you so much for this consideration.
Thank you. Okay, we have testimony, comments from the Department of Budget and Finance, and in support from ILW Local 142. Members, any questions? Okay, seeing none, moving on to SB 819 SD2, relating to the hospital sustainability program. We have Department of Human Services.
Hi, good morning. This is Judy Moore Peterson, MedQuest Director for the Department of Human Services. We stand in strong support of the hospital sustainability bill of Senate Bill 819. Thank you so much.
Okay, thank you. Okay, and we have Queens Health Systems.
Morning, Chair and Vice Chair. J.C. Mikulanic on behalf of Queens Health Systems. We stand in strong support of this Senate bill, and are here to answer any questions. Thank you.
Okay, thank you. Healthcare Association of Hawaii.
Thank you, Chair Yamani, Vice Chair Tam, members of the committee, testifying in strong support of SB 819, and thank you for your support of this program. Thank you.
Okay, thank you. Okay. Hawaii Pacific Health.
Thank you, Chair. Mike Robinson, standing on our written testimony in strong support.
Okay, thank you. Oh, the beard is growing out fully, huh? All right. Okay, members, want you to know that Adventist Health provided testimony, Castle testimony in support, Kaiser Permanente in support, Hawaii Primary Care Association in support, and Jennifer Azuma provided testimony in opposition. Okay, members, any questions? Okay, seeing none, moving on to SB 1340, relating to emergency medical services. The Hawaii State Fire Council.
Hi, Chair Yamani, Gary Lum here. We're in opposition of SD2 as is written, because it misaligns the licensure at the state level and categorizes non-ambulance EMTs as emergency medical responders, which is not the certification level they've attained. Thank you.
Okay, thank you. Okay, DCCA.
Good morning, Chair, Vice Chair Lonnie Keoki, Executive Officer of the Hawaii Medical Board. The board will stand on its written comments, appreciating the intent and again offering comments. Thank you.
Okay, thank you. Okay, Department of Transportation. Okay, any from DOT? No, no, Ross. Okay, fixing those potholes. All right, the members, we have Department of Health in support, Hawaii Fire Department in opposition, American Medical Response in support, individuals Dale Oda in support, Kurt Morimoto in support, Tito Villanueva in support, and Jennifer Azuma in support. Members, any questions? Okay, seeing none. The chair has a quick question. DCCA?
Yes, sir.
Hi,
Morning.
Hey, you know, in regards to one of the recommendations to develop a specific licensure for the EMT that meet the NREMT requirements, but who do not satisfy the EMT transport, having that license so that there is a tier system. Does DCCA see any problem with the potential creation of that?
Other than a staffing issue, we do appreciate the intent. The Hawaii Medical Board does appreciate the tiered system that this bill creates.
Okay, so my understanding is going through that process of looking at these tiers, then we would need to have a department look into it, right? And then give a report back to the legislature to institute a new license as a sunrise? Or does this qualify already as because of the underlying licensing certification process has already been done, that this bifurcation is already, doesn't require that?
The latter part of your statement, it does not require a report to the legislature. It's just, again, a bifurcation of the license. So making a new tier of a particular license.
And then how, what would be prohibitive to have these things done? This new certification to licensure and the new tier, is that basically resources for administrative?
That is correct, sir. We do only have one office assistant, 5 assigned to the Hawaii Medical Board, who processes currently all emergency medical personnel applications. And right now we license at 3 different levels or tiers. We also have 1 office assistant, 4 assigned to the Hawaii Medical Board, who processes all record transactions for the entire board. And that includes physicians, physician assistants, podiatrists, emergency medical personnel too.
Okay, thank you. Real quick, Fire Council.
Yes, Chair.
Okay, so with the creation, potential discussion, the creation of that that next licensure EMTs that do not satisfy the EMT transport, would that alleviate some of the concerns regarding the having HFD or various people assist with the ambulance system?
Yes, I believe that would address their concerns.
Okay. Thank you.
Thank you.
Members, any additional questions? Okay, seeing none, moving on to SB 821 ST2 relating to children. Okay. No one. Okay, so we have testimony submitted by the judiciary providing comments and Hawaii Youth Services Network in support. Members, there's no one to ask questions to, so we'll move on. Okay, moving on to SB 827 SD2 relating to breast cancer screening. Okay, we have DCCA.
Good morning. Good morning, Chair Yamane and members of the committee. The department stands on its written testimony offering comments on the bill, and we will be available to answer any questions. Thank you, sir.
Thank you. Department of Health.
Thank you, Chair Yamane. I'm Lola Urban, representing Director WHR, and the department stands on its testimony providing comments, and we have provided a link to the U.S. Preventive Services Task Force, and those guidelines are what then guide the Department of Health screening standards for the Hawaii Breast and Cervical Cancer Screening Program. Thank you.
Okay, thank you. HMSA.
Good morning, Chair, Vice Chair, and members of the committee. We stand on our written comments and remain available for any questions that you may have. Thank you.
Okay, thank you. Hawaii Medical Association.
Good morning, Chair and Committee. Hawaii Medical Association stands on our testimony. We're here for questions.
Okay, thank you. Members, to note, we have testimony provided by Hawaii Association of Health Plans in opposition, Hawaii Primary Care in support, Hawaii Pacific Health in support, Kaiser Permanente provided comments, Hawaii Society of Clinical Oncology support, Hawaii Radiological Society support, Hawaii Women Lawyers support, Melissa Martinez in support, and Patricia Blake in support. Members, any questions? Okay. The chair has questions real quickly for Commissioner Hayashida.
Yes, Chair.
So, Commissioner, so this one, the way the bill is written, and with the addition of the 35 to 39, is the interpretation then that this is a new mandated services in totality? That's why it would require a potential review?
That is correct, because the two parts of the bill are combined into one bill. It would be a new mandate. If it was just on the low dose mammography and tomosynthesis, it would not be considered a new mandate. And we did raise the issue to CMS to get their comments. And we didn't provide them the bill, we just provide them the scenario, and they said that they would consider changing the age from 35 to 39 a new mandate.
Was it only on that portion, the 35 to 39?
Yeah, that is correct. That is correct.
So the other portion then would hint that maybe the other House position would not qualify as a new mandate, then, right?
Yes. We'll look at it as mammography was covered before ACA, mammography is still covered after ACA, and this just really speaks to the methods of providing that coverage.
Okay. So the language that this committee passed in HB 309 before then would qualify under, right, as not a mandated new service then, is that correct? Okay.
That would be correct, yeah.
Right, thank you. Members, any additional questions? Okay, seeing none, members, we're moving on to SB 663 relating to the solemn covenant of the state of award prizes for curing diseases. Members, we have testimony by Jennifer Azuma Chirplak in opposition and Liu Lenhart in support. Members, there's no one to ask questions to, so we'll be moving on. Okay, to SB 387 SD1 relating to the room confinement of children at the detention and shelter facilities. Let's see, we have the Office of the Public Defender.
Good morning, Chair Yamane and members of the committee, Deputy Public Defender Darcia Forrester. The Office of the Public Defender stands on our written testimony in support. I'm available if you have any questions. Thank you.
Thank you. Judiciary, State of Hawaii.
Good morning, Chair Yamane, Vice Chair Tam, and members of the committee. I'm Carol Matsuoka on behalf of the Hawaii State Judiciary. We strongly support this measure and stand on our written testimony, and I will be available for any questions. Thank you so much.
Thank you. Okay. ACLU.
Good morning, Chair, Vice Chair, members of the committee. My name is Hope Kripelman. I'm the Legal and Legislative Fellow at the ACLU of Hawaii. The ACLU of Hawaii strongly supports this bill with two suggested amendments. We've received reports in the past of the misuse and overuse of juvenile solitary in our state. Examples include one child of Pacific Islander descent who was held in confinement on the basis of solely verbal outbursts for 31 days straight, and a child who was held in solitary for 7 days because she had head lice, and during this time her suicidal ideation returned. The research is clear that solitary confinement is actively harmful. It forces children to spend 22 to 23 hours a day alone for days and weeks on end. It leads to and exacerbates depression, anxiety, psychological and developmental issues. Many children in juvenile detention facilities already suffer from mental illnesses, and isolation not only fails to address the underlying causes, it actually leads to more harm. One study found that more than half of all suicides in juvenile facilities occurred when young people were held in isolation. Solitary confinement is also counterproductive. It does not work to deter violence. Research shows that extreme isolation actually causes increased antisocial behaviors and aggressive tendencies, and these can persist in the long term. Several jurisdictions that have reduced the use of solitary have actually witnessed a decrease in prison violence. This bill effectively bans the use of room confinement for juveniles except in limited circumstances, which would bring Hawaii into alignment with the federal First Step Act. We've offered some amendments that we think would further strengthen this bill, and we'd be happy to answer any questions. Thank you.
Thank you. Okay, members, the Attorney General provided comments. The Department of Human Services, Office of Youth Services in support, and Hawaii Psychological Association in support. Members, any questions? Okay, seeing none, moving on to SB 589 ST2 relating to the University of Hawaii. University of Hawaii.
Good morning, Chair, Vice Chair, and members of the committee. So along with President David Lassner and on behalf of the University of Hawaii at Manoa, we stand on our written testimony in strong opposition to this bill. And I'm happy to answer any questions. Thank you.
Thank you. University of Hawaii University of Hawaii Cancer Center in opposition. Let's see, hold on. Okay, HPC, Hawaii Primary Care, HPCA, sorry. Okay, no, all right, okay. So then we have here Joel Ramos.
Morning, Chair Yamane, Vice Chair Tam, and members of the committee. Aloha kakao. I'm a professor at the University of Hawaii Cancer Center, and I have the privilege of serving my outstanding colleagues as deputy director there. But today I'm providing personal testimony against SB 589 ST2. This year, the Cancer Center is celebrating its 50th year serving Hawaii to reduce the burden of cancer in the state through research, patient care, education, and outreach. It is our goal to improve prevention and treatments for all the 7,000 of us in the state that will be diagnosed with cancer every year. We've been an organized research unit at the UH since 1981, and we've held NCI designation for the last 25 years. And that's what this bill jeopardizes. It's our NCI designation. So why is that so important? This designation is by the National Cancer Institute. It's only bestowed about 4% of the cancer centers across the United States. Every state wants one. Every state is trying to get one. Just as importantly, this designation comes with funding, and it's a funding multiplier. It allows our faculty, who are the highest quality in the country, to get cancer funding. Most of the NCI designated cancer centers are the primary places where cancer funding goes. We're reviewed every 5 years for this designation, and what they look at is the quality of our research, but really importantly, how do we serve the state of Hawaii? How do we find better treatments for our citizens? How do I identify and prevent cancers in our highly diverse populations? So it's all about quality research that serves the state. We've held this for so long for just a few reasons. We are remote, we serve a remote and important place. We have a really diverse population that's underrepresented elsewhere. And we have a highly supportive university and thankfully a highly supportive legislature. Lastly, our director controls the hiring space and finances of the center. It's this last point that this bill undermines. By taking away that primary differentiator, it endangers our designation. So you would expect there to be extraordinary reason for the legislature to do this, but I can't find one. The reasons given are based on reports from 5 years ago. They no longer apply. We've met those challenges under the leadership of Dr. Holka.
Okay, moving on. Thank you. Okay, Cliff Martin. Cliff Martin, nope, okay. And let's see. Members, we have the University of Hawaii Professionals Assembly in opposition, UH Cancer Center in opposition, American Cancer Society provided comments, Hawaii Society of Clinical Oncology in opposition, and a whole slew of individuals providing testimony in opposition. Members, any questions? Okay, seeing none, the chair has a question for the University of Hawaii.
Yes, Chair.
Okay, hi. I know one of the things that was brought up regarding the certification for the NCI designation was the issue of the potential status of the cancer center in regards to being tied under JAPSIT. if it was tied where it's directly with the president and the regents, would then that ensure that it's autonomy to meet the NCI?
The NCI, in my discussions with the NIH, has made it clear that they consider it essential that the director of the Cancer Center report on a level equal to the deans. The deans at the university report directly to me as provost, and so it would be essential that the director continue that reporting. Thank
So
you.
if the language then is modified so that they report to you directly, which you then report to the regents, right, and the president, right, then that would address the concerns about the NCI violations.
That would address that concern, but what remain are the other concerns that we have, in particular, the restriction on the use of certain budget types. So as you probably know already, the university receives approximately 50% of its support through tuition revenue. The bill as written restricts the use of that revenue as well as the revenue associated with research grants.
Well, on that note of research grants, there was several issues that was requested on behalf of the university system to enhance your guys' capabilities, especially with the issue of timely and efficient commercialization of intellectual property, right? Which I think would overlap with your system, as well as with dealing with research in regards to providing the university systems the express statutory authority to enable and facilitate the deployment of educational instructional resources, managerial fiscal resources, university personnel, and diversification of workforce opportunities for commercialization of inventions and discoveries. Is that correct?
Yes, that's correct. Particularly important in this area of the university.
Kind of overlaps with what CRC and what you guys are doing. Is that correct?
That's exactly correct, Chair.
Okay. So, all right, you might have revived the vehicle. Okay, members, any additional questions? Okay, seeing none, moving on to SB 1139, relating to the Office of Medical Cannabis Control and Regulation. The Department of Health.
Good morning.
Okay, please proceed.
Oh, hi. Good morning, Chair Yamane, Vice Chair Tam, and members of the committee. My name is Tammy Whitney. I'm with the Department of Health Medical Cannabis Registry Program, and the department wishes to stand on its written testimony in strong support of this measure. I'm available for any questions. Thank you.
Okay, thank you. Okay, Hawaii Cannabis Industry Association. Okay, no. Mr. Blake Oshiro, no. Okay. Akamai Cannabis Clinic.
Good morning, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify on this measure. My name is Dr. Clifton Otto. I'm a cannabinoid medicine specialist in Hawaii. I stand on my written testimony, but I just wanted to speak very briefly to an issue that I see developing that I'm concerned about, and that is cannabis regulators who are state employees forming an exclusive national organization to come up with policy on their own that can then be implemented through dispensary rules without any oversight from the legislature and public input. And right now, our medical cannabis program does not have a medical cannabis advisory board, not even a medical cannabis specialist on staff, and is operating under interim rules since 2015, which suspends Chapter 91 administrative procedures. So there's no way for the public to provide input on new dispensary rules that will affect patient safety. So I am offering 3 suggestions for amendments that I believe will address some of the problems that we're facing right now. And I appreciate you considering these in your decision-making today. Thank you, and I will be available for comments and questions.
Thank you. Okay, members, any questions for? Okay, Representative Ward.
I have a question to Dr. Otto. Dr. Otto.
Yes, Representative Ward.
Are you suggesting that they may not be qualified, or they may not be confident, or they've made bad decisions of which you want to rectify?
Well, I would say a little bit of all of the above. There are some decisions that I believe could benefit from having a medical professional who has direct experience dealing with medical cannabis patients, because that perspective is critical for making new rules and having a program that addresses the issues of our patients. And our whole program was created for the benefit of our patients. So that's why I'm suggesting that that level of expertise be part of the program. Hawaii is unlike any other state, and we really need to make use of our local medical experts who have clinical experience and educational background in this subject.
But so far, no blunders, though, right? That was my point.
There are several issues that I have raised in my testimony that is available for the public record. I have seen several issues that I think could have been prevented if there was medical cannabis expertise in the department.
Thank you very much. Thank you, Chair. Okay, thank you. Okay, any additional questions? Okay, seeing none, moving on to SB 1142 SD2 relating to services for Kapuna. Department of Health, Executive Office of Aging. Okay, no?
Morning, Chair. Can you hear me?
Yeah. Okay, please proceed.
This is Aaron Arakaki, filling in for Caroline Cotterell, who's not available today. The Executive Office on Aging stands on our written testimony in strong support, and we are offering just one technical amendment, requesting to change the term chore performance to chore. And I'll be available for any questions.
Okay, thank you. AARP.
Hi, good morning, Representative Yamane. This is Audrey Suganakaga from AARP, and we stand in strong support of this measure. Thank you very much.
Okay, thank you. Alzheimer's Association.
Mahalo, Chair Yamane, Vice Chair Tam, members of the committee. The Alzheimer's Association supports allowing the 30-hour working requirement included in this bill to be flexible during emergencies like the pandemic. We specifically want to ensure that caregivers that require these services to be able to return to work haven't lost their eligibility and therefore caught in a catch-22 where they need these services to return to work but cannot return to work until they have these services. And so for these reasons, we are in support of this measure. Thank you very much.
Okay, thank you. Let's see. We have Department of Human Services in support, Hawaii Alliance for Retired Americans in support, Hawaii Family Caregivers in support, Policy Advisory Board for Elder Affairs in support, and a number of individuals, both in late testimony, in support, except for Jennifer Azuma Triplak, who is in opposition. Members, any questions? Okay, the chair has a question for, I guess it would be Department of Health. Hello, you there?
Hey, go ahead.
Okay, so your recommended language change on page 460 goes from plural chores to chore. Is that going to be interpreted as one chore, or you mean plural as variety of chores?
Chore is the type of service, so it's no different than the other services which are described singular.
You
So
guys
it shouldn't
as a
prob-
category and not as an individual activity.
That's correct. That's
Okay.
correct. It's a
All right.
service category.
And then, are these providers are they all considered mandatory reporters?
Providers, what do you mean? Which providers?
Providers, those that doing the service, are they considered mandatory reporters?
Absolutely, absolutely. That language is contained in their contracts.
Okay. Is that in statute?
Is what in statute?
The requirement that they're mandatory reporters and that they get APS trained?
It is in the state statute that they are, based upon their role and responsibility, are mandatory reporters.
Okay. All right. And then in this version of the bill, it says the director may adopt rules. So is this being done without rules currently?
Currently, the EOA has not established any administrative rules for the program as of yet.
Okay. How long has the program been?
2017 it was passed, so it's a fairly new program that we are still trying to fully get off the ground. It was of course 2020 was a huge challenge, and things came to a standstill. So we're trying to regroup at this point in time and get back on track.
Okay. All right. Thank you. Okay. Moving on to SB 221 SD1 relating to homeless. Hawaiian Affairs Caucus of DPH. Okay. All right. So we have the Governor's Coordinator on Homelessness providing comments. Hawaiian Affairs Caucus providing support. Office of Hawaiian Affairs in support. Hawaii Health and Harm Reduction Center providing comments. Hawaii Youth Services Network in support. Catholic Charities providing comments. Samuel Kalolulo providing in support. Leimomi Khan in support. Annie Chang in support, and Jennifer Azuma Sherplak in opposition. Members, any questions? Okay, seeing none. Hold on. Let's see. No one's here to answer questions. So, okay. Moving on to SB 324 SD1 relating to the practice of medicine. We have a DCCA.
Hey, good morning, Chair, Vice Chair, Alani Keoki, Executive Officer of the Hawaii Medical Board. The board will stand on its written testimony in support of this measure. Thank you.
Thank you. Kaiser Permanente. Okay. They provided testimony in support. Regulated Industries Compliant Office provided testimony in support. Members, any questions on 324? Okay. All right, seeing none, moving on to SB 900, Department of Health.
Good morning, Chair. My name is Matthew Shim. I'm Chief of the Family Health Services Division, Department of Health. The department stands on its testimony providing comments, and I'm available to answer any questions. Thank you.
Okay, thank you. Hawaii State Commission on the Status of Women.
Aloha, Chair, Vice Chairs, members will stand on our testimony. Thank you.
Okay, thank you. Department of Human Services.
Aloha, Chair. Judy Moore Peterson, MedQuest Administrator for the Department of Human Services. We stand on our written comments, on our written testimony providing comments. Thank you. Available for any questions.
Okay, thank you. Healthy Mothers, Healthy Babies.
Thank you, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify. My name is Sunny Chen. I'm the Executive Director of Healthy Mothers, Healthy Babies. We stand on our written testimony in strong support. According to reports and analysis from the Premier Healthcare Database, the cost of a vaginal delivery with severe maternal morbidity is 88% more than the cost of a vaginal delivery without severe maternal morbidity factors. The cost of a C-section, 155% more than the cost of a vaginal delivery without severe maternal morbidity factors. Now consider this, more than 1/3 of these are preventable. That's a huge savings in healthcare costs for the state. No matter what the amount of various comments have been made about the costs associated with a task force or implicit bias training, I would like to acknowledge that the work hospitals and state departments have done recently to collect better data, but I would like to respectfully ask for your consideration to bring the task force back and ensure that implicit bias training is done. What is the cost of mental illness, trauma related to childbirth? What is the cost of our state related to postpartum hemorrhage? A NICU stay? What is the cost of generational trauma and stress? Fear that our pregnant and birthing people experience prior to going to deliver their babies. The day that is supposed to be the most happiest day, they're stressed out. We can't build a beautiful house without all of the people to contribute to it. We need contractors, designers, draftsmen, all providing important input to creating the perfect house for a homeowner. We can't leave the homeowners, the community out. Thank you.
Thank you. Okay. Hawaii Children Action Network.
Good morning, Chair and committee members. Kathleen Algar with Hawaii Children's Action Network speaks. You have our testimony in support. We think this is a necessary step forward. We believe, that a healthy childhood stems from a healthy pregnancy and healthy mom. Thanks so much.
Okay, thank you. Queens Health Systems.
Aloha, Chair J.C. Mike Young on behalf of Queens Health Systems. We respectfully oppose the Senate bill for reasons expressed by our colleagues at HAH and HPH, largely believing that the work being undertaken would be duplicative potentially. We'd prefer to be able to continue to work on our own implicit bias trainings and so forth that are ongoing here at our organization. Thanks very much, Chair.
Okay, thank you. Then HHH.
Good morning, Chair. Thank you for the opportunity to testify. As noted, we do support the intent of this measure, but we do oppose the measure as it is currently written. We are concerned that this will take away resources from years-long collaborative efforts, but we do note that we concur that we should do more to expand and review morbidity events for mothers, and we do look forward to encouraging more community participation on existing collaborative groups. Essentially, I think what we're saying is we feel that we can achieve what this bill is seeking to without having to create new programs and increase spending. Our members are committed on this issue. They're putting in incredible time and resources to bring the quality of care for all mothers in the state to the high standard that I think most patients in this state do expect from our providers. And we would also note that implicit bias training is being undertaken at our hospitals. It's much more broad-based to look at a number of potential implicit bias areas. But if there is a will to focus on training for perinatal hospitals, we would note that there are a number of federally recognized training programs that would take away the concerned resources that were expressed in some testimony. 2 trainings a year is simply too limited. And we believe that the use of a nationally recognized, clinically focused training would provide essentially the goal of providing this training to perinatal staff without having to put additional resource constraints on our state agencies. Thank you for the opportunity to express our concerns and our commitment to improving maternal health in the state. Thank you, Chair.
Okay, thank you. Hawaii Pacific Health, representing the Kapiolani Women's and Children's Hospital.
Good morning, Chair and Vice Chair and Committee. HPH will stand on its written testimony in opposition to this measure. Thank you.
Thank you. Brianna Zoe.
Hi there, I'm here. Thank you very much for the opportunity to testify in this legislation. My name is Brianna and my pronouns are she, her. And I'll be honest, I am not an expert on this matter at all. I'm just a concerned citizen who wants to make things better for my fellow women. And you know what? I feel like the voice of regular people is not heard enough in our legislation. So here I am. I feel that the fact we still have women struggling and suffering so much in a time when they're giving, birthing a child is supposed to be an amazing time in somebody's life, yet we are still allowing people to struggle and suffer intentionally or not because of the color of their skin or their race or ethnicity or sexual or gender identity, whatever. And to me, this is totally appalling. I can't imagine why anybody would oppose this legislation. I hear people saying it'll cost too much money. The efforts are duplicative. We're already trying this. We're already trying that. But you know what? I don't think we're trying enough. Why shouldn't we be trying more? There is no reason why women are supposed to be suffering and struggling when we can clearly do more. I really feel like, and again, I'm just a normal person. Who the heck am I to be speaking on this? I don't even know why I'm here, but you know, I really do think that we should be doing more. We can be doing more. We need data that is understandable. We need data that we can act on. Implicit bias training, it all just makes sense. And I hope you don't take the cop-out way here of saying, we're already doing enough, because what if this was your partner or your daughter or someone in your family or someone you love who is having a horrible experience in the healthcare system? I hope you can keep moving this legislation along and keep the conversation happening, because it just makes common sense. Thank you.
Thank you. Okay. Sarah Michael Hamid.
Aloha Chair, Vice Chair, and members of the committee. My name is Sarah Michael Hamid, and I testify today in strong support of SB 900, otherwise known as the Maternal Health Equity Bill. SB 900 is not simply a bill. It is not simply a piece of legislation or an ideal that could potentially improve the status of healthcare in Hawaii. It is a necessary transformation to the healthcare system to prevent the death of mothers and babies. Our healthcare infrastructure for mothers and birthing people in Hawaii is abysmal and crumbling at best, and we need to protect the most vulnerable in hospital spaces. SB 900 would do just that and will improve research and data collection of maternal mortality and morbidity by disaggregating the data that we already don't collect. Though there has been much confusion, currently maternal morbidity isn't tracked or collected in the state of Hawaii, which makes addressing maternal morbidity in our communities that much more difficult. As a state, we have one of the worst health ratings in the area of maternal health, and this is a crisis and it needs to stop. As a young woman of color who would like to be a mother one day, I fear that the hospitals and healthcare system more broadly in Hawaii fail us too often to even feel comfortable going into a hospital facility to give birth. Not only do I feel this way, but many community members echo the same sentiments, especially during the COVID-19 pandemic, where mothers and birthing people were forced to labor alone, with masks on, and without support people. These systematic issues facing mothers and birthing people have only been exacerbated by the pandemic. And furthermore, the exclusion of community members from public health matters has led to the crisis that we see today, where emphasis is not placed on involving the actual community. Frankly, it is disheartening to see the removal of the task force from SB 900. And there have been many claims that community-centered spaces surrounding maternal health already exist. And to that I say this: when we say we need to center community, we do not mean only people with PhDs. When we say community needs to be at the table, we mean the whole table, not just one seat. When we say community should be at the center, we mean the center, the voices.
Okay. Okay, moving on to Tanya Smith Johnson.
Hello, thank you for having me. What does it mean when we say we support the intent of a bill? Does it mean we agree, but we're just not going to do it? We keep hearing that we are already doing this work. This work is duplicative. It's unfortunate that our own departments of health and departments of human services don't know that MMR stands for the Maternal Mortality Review Committee, not morbidity, because we're not collecting morbidity data as of now. Maybe therein lies the problem. This isn't the case in regards to we're doing this work already, but let's say it is. We are failing. We have a D+. Black mothers and their babies are experiencing preterm birth and labor more significantly than their white peers. I, as a Black mother who has birthed 6 times, would be afraid to birth here again. I would go to the mainland before I birthed here. What's the plan to stop birthing people from experiencing racial disparities? Where is it if we're doing it already? What is the plan for COFA birthing people so that they are not harmed? Where is it? Where is it written? What are we doing? I can tell you what we're doing is a failure. People can't lie and miscommunicate information and fudge numbers and data and say they're doing the work. An industry cannot police itself. The healthcare Association claims they are the leading voice. You know who should be the leading voice? Birthing people, especially the birthing people who are most harmed. And here in Hawaii, those are Black birthing people, Native Hawaiian birthing people, Pacific Islander birthing people. Those are the people who should be the experts. Those are the people who should be centered. Those are the people we should be listening to when they say they are harmed. They are the canaries in the mine. They are telling us what is happening. Are we listening? What's the plan? What are we going to do about it? Hawaii needs to begin to be the lead on this instead of waiting 10 years from now to finally realize what we already know, that we're doing this wrong. Thank you.
Okay. Ilani Lasconia.
Aloha, my name is Ihilani Lasconia, and I testify today in strong support of Senate Bill 900, otherwise known as the Maternal Health Equity Bill. So Senate Bill 900 is not simply a bill, but a piece of legislation that would drastically improve the way healthcare runs and operates in Hawaii. Senate Bill 900 is a necessary transformation of the healthcare system to prevent mothers, birthing people, and babies from dying, especially when these birthing people and babies are people of color. Our healthcare infrastructure for mothers and birthing people in Hawaii is extremely subpar, and Senate Bill 900 is essential to protecting the most vulnerable in hospitals while we work to address this healthcare crisis. Through improving research and data collection of the maternal mortality and morbidity, by disaggregating data for race and ethnicity, Senate Bill 900 will allow for healthcare providers and community advocates to understand where gaps exist, combat maternal mortality and morbidity, and improve overall maternal health for the communities of color most affected. So many of us know far too well that medical racism is real and that healthcare in Hawaii is not absolved from that. SB 900 is essential to addressing medical racism through providing the data that is essential to proving these disparities. In February of this year, my sister, who is Kanaka Maoli and Filipina, gave birth to her first daughter. Although we are overjoyed that her baby and now her are healthy and home, the complications that my sister faced and the danger that the healthcare system put her and her baby in has been devastating. Throughout my sister's pregnancy, she had immense pain, nausea, and a rash that covered her entire body. Instead of taking her pain seriously, medical doctors refused to see her and chalked her symptoms up to her having scabies. The result of this negligence and malpractice was my sister having pancreatitis, a failing liver, damaged kidneys, the removal of her gallbladder, and my sister being born premature. This is just one example of how healthcare providers in Hawaii do not take the pain of birthing people of color seriously. Although these events were terrifying, it is unfortunate to say that my sister and our niece are one of the most lucky people to have survived this type of harm. This pain and medical trauma could have been prevented if SB 900 were already in place and medical doctors knew how to better treat birthing people of color in this system. We cannot wait any longer. We must take their pain seriously. You must take our pain seriously. And one of the ways that we can best do this is through the passing of Senate Bill 900. Thank you so much for your time and consideration on this very urgent issue.
Thank you. Jasmine Potiles Dave. Okay. Alexandra Bagos. Nope. Okay. Yvonne Mehelona. Okay. So members, we have testimony from Affirm Hawaii in support, Office of Hawaiian Affairs in support, Hawaii's Women Coalition in support, My Movement Hawaii support, Hawaii State Coalition Against Domestic Violence in support, Planned Parenthood in support, Hawaii Indigenous Breastfeeding Collaborative in support, Healthy Mothers, Healthy Babies in support, a whole list of individuals in support. Members, any questions? Representative Ward?
Thank you, Chair. Department of Health, please.
Yes, Representative Ward.
First question is, how do we rank vis-a-vis the other states? Where are we in terms of top 10, top 5, bottom 10? It says we're really, as a country, low, but how is Hawaii ranked in terms of the maternal morbidity, or in this case, mortality?
For maternal mortality, the state of Hawaii is very low throughout the state. In 2018, we had 10 maternal deaths In 2019, there were 11 maternal deaths. And as of October of 2020, there were 9 maternal deaths reported in the state. Maternal death is defined as a woman who dies within 1 year of becoming pregnant or giving birth.
So how do we rank vis-a-vis the other 49 states?
I'd have to look to see the actual ranking of that. I don't know if there's a specific ranking, but based on our population and our numbers of 10, around 10 or less, I would say that we're probably very low compared to other states.
And as I looked at the bill, I assumed you were already doing this, but you're not. So what are you doing now that this bill is going to make you do?
For maternal deaths, we do medical record reviews that do review maternal morbidity, but there is not a surveillance system to review maternal morbidities throughout the state that are not related to maternal deaths.
Could you say that? I'm not sure I caught that. What are you doing now versus what this bill will ask you to do in addition?
So the bill is asking to create or collect maternal morbidity or illness data throughout the state for all women for all different types of maternal morbidities. The maternal mortality review does review illnesses that are related to maternal conditions, but only for those women who have died due to becoming pregnant or giving birth within 1 year of their death.
So it would not be duplicative then? Question mark.
There are other efforts through other programs that are not part of the Department of Health that are also looking at maternal morbidity.
Thank you, sir. Thank you, Chair.
Representative Capella?
Ms. Smith? I see you have.
Yes.
I see you have your hand up. I was wondering if you wanted to elaborate on anything else.
Yes, Hawaii. Hawaii has a D+. We're not doing well in regards to where we rank nationally. I think we're like 36 or 38. So we're kind of at the bottom. It's based on, yes, the Department of Health is saying just 10, but that's because our population is so small, but comparatively to the rest of the nation, we're doing awful. So that was my comment.
Thank you for sharing.
Okay, thank you. The chair has questions. Department of Health?
Yes, Chair.
I was going through your testimony. I know you guys testified in providing comments. However, sounds like in opposition, but the comments you provided that currently is that the proposed to establish new data requirements and reporting is overlapped with what you currently doing with DHS. Is that the way I read your testimony? That in combination with you and DHS, you are covering the issues regarding the surveillance system and the Centers of Disease Control Prevention issues of mobility? No?
No, that is not correct. We would have to establish, like I was telling Representative Ward, if we were to look at all maternal morbidity conditions that were not related to maternal mortality or maternal deaths, we would have to create those surveillance systems. Currently, we do work with DHS and the medical examiner's office, the different hospitals through our maternal mortality review committee to review maternal morbidity of those women who have died within 1 year of giving birth.
Right. Okay. So the the Maternal Morbidity Review Committee that was established last year, is that addressing the issues as stated? It's supposed to review the in-depth medical records of maternal death and maternal morbidity data based on race and ethnicity.
Correct. So since 2016, when the Maternal Morbidity Review Committee was reestablished by law, we have reviewed over 40 maternal deaths through the Maternal Maternal Mortality Review Committee, and we provide legislative updates via our annual report every year, and we work to with our committee and community members to find those preventive measures to reduce maternal death.
Okay. Department of Human Services. No, no one here?
No, I apologize. I was struggling to get off of mute and to be visible.
Okay, so I have here that in your testimony, it says, for DHS to collect and compile the data as outlined in the bill is duplicative and already underway. In what way?
Oh, thank you for that question, Chair. I would note that part of it is duplicative and part of it would be new. So we do collect some information on Medicaid related maternal mortality or maternal morbidity data, et cetera. It's not through the clinical records. However, it's through claims data. We do participate in the Maternal Mortality Morbidity Review Committee. And also we did have an error in our testimony. We do know the difference between maternal morbidity and mortality, but it was not corrected in the testimony. We apologize for that. And so we do collect some of that information currently. We're in the process of collecting data through the All-Payer Claims Data Warehouse. Currently, we have the authorization to collect data for public payers through the claims data, but we do not have authorization to collect any of that claims data from any commercial or private payers. So those are some of the examples of where we currently collect some of that data. We can work to expand it, but we don't have the authorization or the ability today to collect all that information that we're being directed to collect.
Okay. Hawaii State Commission on the Status of Women.
Your
Hello,
chair.
Hello.
Hi, here for.
Okay, so because I know you're attached, right? So are you that since both departments are saying that they have the data or somewhat, are you guys willing to do that? Do the data collection and then have it run out of your department at or your agency?
So our agency has 2 staff. It is myself and then 1 secretary who's limited to just the functions of the office management. So we don't have capacity to oversee that level of data collection on behalf of the Department of Health and the Department of Human Services, unfortunately.
Okay. But you guys are willing to do the bias training?
We are willing to do the bias training. We asked for that amendment. And I want to just respond quickly to the, I appreciate the suggestion for national training, but I think everyone in this room knows that Hawaii is unique. And the contours of racism and the narratives here about racism and how it plays out are different. And we have local experts who we've worked with frequently at relatively low cost who could do this training if we were just able to structure it in a way where we could successfully launch it by offering it at
specified dates during the year. I think it's really important to have in person if we can, rent a large space where we can socially distance. I think that that's also evidence-based in terms of being effective. So that's my only concern with the national. I think that we can do that component if it is amended to be a little bit more tailored to our capacity right now. But I don't think that that should.
Are you part of that maternal mortality review committee?
No, we are not.
Okay, but so if this moved to become one of your mandates, are you guys open to it at this time? Since there's, I guess both departments are expressing that it'll be about a $350,000 impact. Are you guys able to do it? Because it sounds like the proponents trust you guys.
Well, our chair, again, we are essentially, in terms of who could do this, a one staff person. And also our budget in terms of what we have to spend is less than $50,000 a year, and we're facing a cut. So we couldn't shoulder that as a commission, but we are very supportive and take serious the training component. I think that that is doable if amended with the specifications we've requested, but okay. That's my answer to that one. Thank you.
Okay, thank you. Department of Health?
Yes, Chair.
Can you put the commission on your committee?
I'll have to review the legislation because the maternal mortality review is in statute and who members are. So let me look at that and I can get back to you.
Okay, because I mean, as testifying, there's a lot of people that don't trust that the data is accurate and respective. But I am not sure where if they're unable to get the 350,000 plus one FTE, then who's going to shoulder this? Sorry,
and Chair, also the one FTE and the $350,000 estimate is really for the development of the data surveillance system in order to collect the data from the different healthcare systems throughout the state to be able to collect the medical record, maternal illness, maternal morbidity data. We did not have an estimate for the cost of the implicit bias training.
Didn't currently the legislature give Department of Health significant amount of money to upgrade the IT systems on all the various programs?
I'm not sure. I have to check with the.
Is this one of the program hard frame that's going to be improved on with those resources?
I believe this would be a new. It's not necessarily an IT data system, but it's the mechanisms to collect the data, not so much store the data, but actually collect it and get all the inputs from the different health systems.
But the chair supports the intent, but if right now, if people trust the commission and the commission is unable to do it, having them be the primary entity to do it with limited resources. And I think, as stated, the governor reduced some of their budget, and with the hiring freeze, I'm not sure if even the FTE would be filled. So, okay, moving on. Thank you. Okay, moving on to SB 1285 SC2 relating to medical facilities. Kaiser Permanente.
Chair Jonathan Ching for Kaiser Permanente will stand offering our comments and available for any questions.
Okay, thank you. Queens Health Systems.
Aloha, Chair, Vice Chair J.C. Mike for Queens Health Systems. We appreciate the intent of this measure and will stand on our written testimony. Thank you.
Okay, thank you. Healthcare Association of Hawaii.
Hi, good morning, Chair Paige Heckathorn Choi with HHH. Similar to Queens, we would stand on our submitted comments, and do appreciate the intent. And just thank you for the opportunity to submit those comments. Thank you.
Okay. Hawaii Pacific Health.
Mike Robinson. We stand in our written testimony in opposition. Thank you.
Thank you. We have testimony from the Attorney General providing comments. Hawaii Coalition for Immigrant Rights in support. Katie Liu in support. Thaddeus Pham in support. Dina Sheck in support. Barbara Tom in support. Jennifer Azuma Triplak in support. And Neil Palafox providing comments. Anybody wishing to, any questions by the committee? Okay. Seeing no department here, right? Okay. Seeing none, moving on to SB 838 SD1 relating to services for Kapuna. Deja vu, since it's exactly similar to SB 1142. DOH, Department of Health.
Yes, Chair. This is Aaron Arakaki again from the Executive Office on Aging. This is a Kapuna Caucus version of the bill, and we're in strong support and offering some technical amendments to the definition of homemaker and some grammatical changes to the definition of person-centered support plan. And I'll be available for any questions. Thank you.
And probably chores, right? Okay. Department of Human Services.
Good morning, Chair Yamane, Vice Chair, and committee members. Lisa Amador of the Adult Protective and Community Services Program. DHS stands on our written testimony in support. Thank you.
Okay, thank you. AARP.
Good morning, Chair. This is Audrey Suganaka from AARP, and we stand our testimony in support. Thank you.
Okay, thank you. Alzheimer's Association, Aloha Chapter.
Mahalo, Chair. As you identified, this is very similar to the bill I testified on before, so I will stand on my written testimony. Thank you very much.
Thank you. Okay. Members, we have we have Hawaii Family Caregivers Coalition in support, Policy Advisory Board of Elder Affairs in support, and a number of individuals in support. We have a Midori Marcia Sue Trent in opposition and a Jennifer Azuma Triplak in opposition. Members, any questions? Okay, the chair has, no, I already asked it on the other one, so we did it already. Okay, so we will be taking a recess until 11:30 to get quorum for decision making. Thank you. Okay. Okay. Great. Okay. Reconvening the Committee on Health, Human Services, and Homelessness for the purposes of decision making for Tuesday, March 16th, 2021, 9:30 a.m. agenda. Thank you, members. So, first bill, HB 506 SD2, relating to the issuance of the special purpose revenue bonds to assist Hawai'i General Hospital. Members, the recommendation of the chair, and I know I have to talk up because MOHMSO is we're going to blank out the amount, which is 12 million, and then put a 7/1/2060 effective date. Any discussion, members? Okay, seeing none, Vice Chair.
Voting on Senate Bill 506, Chair's recommendation is to pass with amendments. Chair and Vice Chair vote aye. Rep Gates.
Aye.
Rep Har.
Aye.
Rep Capella.
Aye.
Rep LaPresti. Is he on here?
No, I don't think so.
Okay. Excuse. Rep Nishimoto. Rep Ward is excused. Chair recommendation is adopted.
Okay, thank you, members. Moving on to SB 819 ST2 relating to hospital sustainability program. Members, you voted on this as a House bill. We're going to be moving this measure forward as an HD1 with a 7/1/2060 effective date. Okay, members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 819. Chair's recommendation is to pass with amendments, noting the excused absence of Rep LaPresti and Rep Ward, who will remain excused for the rest of the agenda. Any reservations? Any noes? Chair recommendation is adopted.
Oh, Representative Ward is here. Okay, moving to SB 1340 ST2 relating to emergency medical services. Members, the recommendation of the chair is to move this measure forward as an HD1. First of all, we will be changing the effective date to July 1st, 2060. Also, we're going to put in there to have the DCCA look into the creation of a licensure for EMTs who meet the NREMT requirement but do not satisfy the EMT transport. As well as additional tech amendments. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 1340, Chair's recommendation is to pass with amendments, noting the presence of Rep Ward. Any reservations? Any noes? Chair recommendation is adopted.
Thank you. Moving on to SB 821 ST2 relating to children. The recommendation of the chair is to move this measure forward as an HD1. We're going to make several changes. We're going to be changing several of the mays to shall. So, for example, the court shall require child welfare services, shall enter an order of declaration. We will be making some technical amendments and putting a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 821, Chair's recommendation is passed with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Okay, thank you. Moving on to SB 827 relating to breast cancer screening. Members, the chair is going to move this measure as an HD1. As discussed, we will the HB 309, I think, doesn't cause problems with CMS as a new services that would require a sunrise review. So we will be replacing the language which this committee looked at and passed through in HB 309 HD2. And just to highlight to you that the effective date in that is July 1st, 2016. Members, any discussion? Seeing none, Vice Chair.
Voting on Senate Bill 827, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Okay, moving on to SB 663 SD1 relating to the solemn covenant of the states to award prizes for curing disease. Members, I know we talked to several of our colleagues on this measure. So I would like to continue the discussion. So we're going to replace the language that would require DOH to develop a task force to explore the development of this interstate covenant commission for the curing of diseases with a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 663, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Okay, thank you. Moving on to SB 387 SD1 relating to the room confinement of children at detention and shelter facilities. Members, the recommendation of the chair is to move this as in HD1. We're going to be putting in, inserting the 8 Attorney General's recommended amendments. We'll be making some additional tech amendments, which I think overlap with several of the testimony. And we will put a July 1st, 2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 387, Chair's recommendation is passed with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, moving on to SB 589 SD2 relating to the University of Hawaii. Members, thank you. I know I've talked to some of you about this measure. The chair wants to move this measure forward as an HD1. We will be making a couple changes. First of all, we will be deleting the requirement that the Cancer Research Center has to report under or to the School of Medicine. They will actually be then reporting directly to the provost. So we'll address that, which will then, I think, address some of the NCI concerns. We're also going to put in the language in reflection on HB 1065 and 1064. We will combine it and put it in this bill as well, because both bills, 1065 addresses the opportunities for commercializations for inventions and discoveries generated by the University of Hawaii, which would overlap with JAPSM and Cancer Research Center. And the other one is on 1064, which deals with technology transfer to facilitate the University of Hawaii's contribution to the economic development of the state. Okay, members, we will be making technical amendments because it was reported that there are some overlap or duplicative, as noted on page 6 and 7, which will be amended as a tech amendment, and we will be putting it as a July 1st, 2060 effective date. Members, Representative Ward.
Question, Chair.
Yes.
The first point you made was they don't report to JAPSON, but they report to you, and then that word.
Oh, it will be the provost, the person who is responsible. So basically, instead of having it where the way it was written would they look like CRC would be reporting to JAPSON, who would then report to the provost. This would be reporting directly to the provost. So basically, CRC and JAPSON would be equals.
And by provost, you mean the president? Or
the identified curriculum provost, who then reports to the president.
Oh, okay. But you don't want to go directly to the president.
No, we want them to be equal with JAPSON so that they're treated equally and independent.
Even though we gave them autonomy a long time ago. That's another issue. Thank you very much.
All right. Okay. Members, any discussion? And by the way, just if you are worried, we've been working with the author of the bill on this, and she concurs. Okay. Members, any discussion? Okay. Seeing none, Vice Chair, please take the vote.
Voting on Senate Bill 589, Chair's recommendation is to pass with amendments. Any reservations?
Reservation?
Rep. Capella votes with reservations. Any other reservations? Any noes? Chair, recommendation is adopted.
Thank you, members, for your latitude. Moving on to SB 1139 ST2 relating to the Office of Medical Cannabis Control Regulations. Members, the recommendation of the chair is to move this measure forward for continued discussion. Members, the bill currently requests 3 permanent positions for this measure. The chair is going to move it to 1, and we will continue the discussion as presented by Dr. Otto regarding the caliber, but I think that'll be addressed in a future hearing. But currently we'll put 1, and we're going to ask them to also support the administrative services and conduct the study And then members, the study that the chair is going to put in here is to have the Department of Health Office of Medicaid Cannabis Control to convene a task force to explore the issues and development of a dual system program of the legalization of marijuana and the impacts and access to qualified patients. Members, due to the timing of getting somebody qualified to DHERD and hiring, getting up and having work, the chair is going to require them to put in the report by 20 days before this session. So to be done and given to us by next year, December, with the July 1st, 2060. Okay. We need to make some technical amendments, and I am aware that some members might do a reso to address that. Any discussion?
Chair question.
Representative Ward.
In reference to Dr. Otto, did you suggest later something will be taken, or you have a committee report, or his concern about the competency, which to me is, if we're even getting close to legalizing anything, if we're not competent, we shouldn't be going anywhere. So
Well,
you referred to him in a reference to.
Well, I refer that because that issue regarding that is consumer protect CPC issue.
Oh, that's what
And
you referred.
so the next committee, if they choose to hear it, can address that.
Got it. Thank you.
Members, any discussion? Okay, seeing none, Vice Chair, please take the vote.
Voting on Senate Bill 1139, Chair's recommendation is to pass with amendments. Any reservations? Reservations for Rep. Ward? Any other reservations? Any noes? Chair recommendation is adopted.
Oh, thank you. Okay, members, moving on to SB 1142, SD2 relating to services of Kupuna. Members, this is almost similar to SB 838, so we will defer this matter. Moving to SB 221, SD1 relating to homelessness. Members, the recommendation of the chair is to move this measure forward as an HD1. We're going to make several changes. One is that we're going to require, instead of may develop plans, that the council and the coordinator shall develop plans. Also, members, I think it'd be very valuable for all of us to, not only have the data, but see the strategic impact. So we're going to require that they develop a specific strategy to address the unmet needs of each county and submit those reports to the legislature by 20 days prior to the next session. Yeah, and then technical amendments with a July 1st, 2060 effective. Members, any discussion?
Sure.
Yes.
I like the idea when you said shall develop a plan. I would say, given the past performance, if you added the word explicit plan or detailed plan or something that says exactly what they're going to do. My point is they've been a bit loosey-goosey in terms of planning or not planning too much, and they can't over specify it. It's just a comment.
Well, okay. Well, we'll keep it shall because that's typically how we move may to shall.
Some plans can be so vague.
But if the plans are not done to whatever, that's an issue that we can take up policy-wise in the session. Okay. Any further discussion? Okay. Thank you, members. Vice Chair, please take the vote.
Voting on Senate Bill 221, Chair's recommendation is passed with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Thank you. Moving on to SB 324 SD1 relating to the practice of medicine. Members, the recommendation of the chair is to move this measure forward with technical amendments and a July 1st, 2060 effective date. Members, any discussion? Okay, seeing none. Vice Chair, please take the vote.
Voting on Senate Bill 324, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair, your recommendation is adopted.
Okay, thank you. Moving to SB 900 SD2 relating to maternal health. Members, as you guys heard from the discussion, I think it would be appropriate that this measure be, or the task be done where entities trust the people putting it together, which would be the Hawaii State Commission on the Status of Women. However, due to the potential fiscal impact of at minimum $350,000, that we will be working with Department of Health to ensure that they have a seat at the table at the maternal mortality, morbidity group, if we have to then mandate that. and then work with them on seeing if next year we can get them the funding to be able to not only do this and be the collection entity, but also do the bias training. So members, the chair is going to defer this measure at this time. Okay. Moving to SB 1285 SC2 relating to medical facilities. The recommendation of the chair is to move this measure forward as an HD1. Members, we are going to strike out the language in section 1 all the way to page 2 and including accordingly, we will strike out. Members, we are going to put in that this bill serves the communities in which the county with an area greater than 4,000 square miles, or AKA Big Island, and that they will affect the Big Island HHSC system hospitals. Okay. We're also we're going to be putting in enforcement that HHSC systems will do and assist with the enforcement and reporting that was requested by the Attorney General's testimony, and we will put a 7/1/2060. Members, the chair has talked to the Senate Big Island author of this bill, and he is okay with that. Okay, members, any discussion?
Question.
Yeah, your representative.
Have the COFA reimbursements been coming on regularly, or are they still kind of like 10 cents on the dollar? I mean, we spend almost 100 million on some of these costs, education and health. Are we getting the reimbursements? I know it's kind of indirectly, but related to this, because there's a bit of resentment when we made a deal and we never really got paid. Are we getting paid? Just get an update.
So I will defer that to the admin, who is better able to give you the specific. But my understanding, when the federal government worked it out with the state of Hawaii to add them to like the Medicaid and not penalize the state, that was a significant step forward in not impacting our overall budget. As well as we are hoping as future discussions moving forward that these issues get addressed. So those are great questions if you want specifics, but I would defer to probably Judy with Medicaid and with the Department of Health. Okay, all right. So seeing that, members, any further discussion? Okay, seeing none, Vice Chair, please take the vote.
Voting on Senate Bill 1285, Chair's recommendation is passed with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Okay, thank you. Then moving to the last measure, SD 838, SD1 relating to services for Kupuna. Members, the recommendation of the chair is to move this measure forward as in HD1. Members, we will be striking out page 1 and most of page 2 regarding the preamble. And then members, there was some discussion regarding the definition of chores versus chore. So we will let the lawyers deal with that. So that will be probably a technical amendment. And members, we are going to add that in both Kupuna caregivers, qualified caregiver, that they all be explicit in law that they need to be mandatory reporters and that they have adult protection services training, which my understanding you already do, but we'll put it in statute to reflect what's in the what's in practice. And members, as stated in the testimony, that there is no rules. So on page 9, we have that the director shall adopt rules pursuant to the Chapter 91. And we're going to ask them to report back to us with an update report and to give us annual updates every 20 days prior to sessions moving forward. We're going to need to make some technical amendments and do a 7/1/2060 effective date. Members, any discussion? Okay, seeing none, Vice Chair, please take the vote.
Voting on Senate Bill 838, Chair's recommendation is to pass with amendments. Any reservations? Any noes? Chair recommendation is adopted.
Thank you, everybody. We are adjourned.